My name is Belinda Beck. I'm Professor of Exercise Science at Griffith University, and I'm also the owner and director of the Bone Clinic in Brisbane, and I support Healthy Bones Australia on a number of their committees. Osteoporosis is highly prevalent, more prevalent than people think. There's about 1.3 million people who suffer from either osteoporosis or osteopenia, which is low bone mass. You would imagine roughly 1 in 3 women and 1 in 5 men are going to have a fracture but after the age of 50 that's related to low bone mass. And this is, as I mentioned, it occurs after the age of 50 because it is definitely an age-related condition. So you gain bone when you're young, you plateau for a while, and then you begin to lose. The reason why most women are affected, more women that are affected than men, is because the advent of menopause coincides with withdrawal of circulating estrogen, which is very protective of bone. If you take estrogen away, there's a period of 5 to 8 years where there's an increased rate of loss of bone. So women don't gain as much bone when they grow, and they lose more across life, so they're much more likely to fracture in old age. Men also suffer from osteoporosis, but as I mentioned, not as commonly as women because they gain more bone as they grow and they tend to hold on to it for a little longer. Plus, they remain stronger than women, and so they're not as likely to fall in old age. The people who are most likely to have osteoporosis are normally the people who are not as active. They don't have a decent diet, and they probably engage in too much drinking and smoking and other bad, unhealthy lifestyle choices. But you cannot get away from the fact that this is a genetic disease. So probably 60 to 80% of your risk of osteoporosis is determined by your genes. So the lifestyle element is very important, but you have what you have in that genetic blueprint that you've inherited. It's difficult to gauge how the impact of osteoporosis on the productivity of Australians and ultimately the economics. It is certainly the case that people begin to develop low bone mass while during their working years. If people are retiring sort of between 65 and 70, they absolutely have every chance that they will have either had a fracture or been diagnosed with low bone mass before that time. It's very, very common for that to be the case. Having a fracture is the worst manifestation of the condition because that's what's associated with pain and an inability to complete many of the activities of daily living. Certainly if you have a hip fracture, then you'll almost certainly be going to hospital. So the cost of that, the direct costs are very high, around in the order of about $33,000 for a hip fracture, and that's just the direct costs. So the cost to the economy of people's not being able to work is obviously far greater than that. It's really important to note that only certain kinds of exercise improve bone. So the kinds of exercises that don't improve bone are low intensity, so the kinds of things that are normally associated with aerobic exercise, so they're very good for your heart and lungs and metabolism. Things like walking, swimming, cycling. Excellent exercises for all of those other systems, but they don't increase bone mass. So if you have osteoporosis, doing those things is not going to increase your bone. What you do need to do is exercise that causes large muscle forces on the bone. So this is lifting heavy and also loads that are applied rapidly, and this is why we incorporate impact loading. So landing from jumps, apply these fast loads, and bone loves that. Recently we developed a statement on exercise prescription to support the management of osteoporosis. This was an initiative of Healthy Bones Australia. It was developed for exercise physiologists and physiotherapists for the exact reason that I stated before, that this kind of effective exercise for osteoporosis should be done under the supervision of experts. So this particular document gives a lot of the background, a lot of the evidence behind the prescription in terms of the ideal loadings for bone. It includes a lot of information about how to prevent falls and the background for that. There's a very specific exercise prescription in a table addressing those various elements, bone loading and balance. And there's also an element in there for special considerations for people who perhaps have osteoarthritis or neuromuscular conditions and so on, for managing them. So it is a very specific document designed for those allied health professionals who do have training in exercise therapy for their clients so that they can implement it in their practices. In the last 10 years or so, we have undertaken a number of studies, clinical trials, to show that high intensity resistance and impact training is the most effective strategy to improve bone if you have low bone mass. In fact, it's the best strategy even if you don't have low bone mass. The trick or the caveat is that with a frail population, people who have low bone mass already, you may put them at risk of fracture if you apply those kinds of loads in an unsupervised setting. So we highly recommend that people undertake a high intensity resistance and impact training program, such as what we have developed, but to do so under the supervision of an experienced exercise provider.